Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What are steroid eye drops? Steroid eye drops can help quell problems associated with eye inflammation caused by allergies, post-surgical issues, and other conditions. These medications include prednisolone eye drops, steroids such as loteprednol, injections, and more. Such steroids, as a rule, interrupt gene pathways that otherwise would lead to uncontrolled eye inflammation. /r/n/r/n All steroid eye drops, however, are not the same. The unique structure of each can make a difference in how it functions, what it treats, and what the side effects may be. /r/n/r/n This article discusses 5 types of steroid eye drops, as well as the uses, precautions, and side effects of each. /r/n/r/n Getty images /r/n/r/n This ophthalmic steroid goes by the brand names Illuvien, Retisert, and Yutiq. /r/n/r/n Rather than being drops, these are injected intravitreal implants that place the medication in the vitreousa gel-like substance in the back chamber of the eye. The implant provides sustained release of the medication. Each brand is a little different and may have its own appeal. /r/n/r/n In general, Fluocinolone is used to reduce retinal swelling. /r/n/r/n Illuvien is prescribed for the treatment of diabetic macular edema. It is used in those who have been previously treated with ophthalmic steroids but who did not have their eye pressure rise significantly. This intravitreal implant is injected with a small needle into the eye and is expected to last for 36 months. /r/n/r/n The Retisert implant is placed in the back of the eye where it locally releases Fluocinolone over time. It is used to treat inflammation associated with chronic non-infectious uveitis in the middle tissue layer of the eye wall. This implant is expected to last for approximately 30 months. /r/n/r/n The Yutiq implant is also used for treating non-infectious uveitis at the back of the eye. This implant is designed to last for up to 36 months. /r/n/r/n The milligram, mg, dosage of fluocinolone acetonide for each implant is, /r/n/r/n An intravitreal injection can help ensure you get the medication at a steady rate, without interruption. However, there is the potential for serious eye infection, eye inflammation, raised or lowered intraocular pressure, and even choroidal or retinal detachment. There is also a possibility that an implant could move and cause a tear in eye tissues. /r/n/r/n It is possible to temporarily have blurry vision after the implant is first placed. You should not attempt to drive or operate any kind of machinery until your vision clears. /r/n/r/n Fluocinolone can also have steroid-related effects. Tell your healthcare provider if you have a history of ocular herpes simplex, since this viral infection can reoccur with steroid use. /r/n/r/n Also tell your healthcare provider if you've had glaucoma or an eye infection, since steroids can spur reoccurrences and increase intraocular pressure. Be sure to alert the healthcare provider if you have any allergies to any part of the medication. /r/n/r/n Occasionally there can be side effects from Fluocinolone ophthalmic implants. Contact your healthcare provider immediately if you have any of these more serious side effects. /r/n/r/n Minor side effects may include /r/n/r/n Talk with your healthcare provider if any of these symptoms don't improve or get worse. /r/n/r/n This steroid eye drop is considered a safer soft steroid with an active ingredient that is rapidly deactivated as it is absorbed by the body. /r/n/r/n It goes by brand names such as uveitis, Inveltis, Allrex, Lotemax, and Lotemax SM. Depending on the brand, the medication will be an eye drop suspension or gel. /r/n/r/n. This type of ophthalmic steroid is approved to reduce pain and inflammation after eye surgery such as cataract removal. /r/n/r/n. Commonly, this is also used to treat /r/n/r/n. The dosage varies slightly with each brand. /r/n/r/n. While loteprednol can help in many situations and is considered somewhat safer than some other drops, it is still an ophthalmic steroid. Keep in mind that /r/n/r/n. Even though this soft steroid may be better tolerated, in some cases side effects can still occur, such as /r/n/r/n. This corticosteroid drop is also considered somewhat safer than some of the other ophthalmic steroids. It may be given in cases where there are particular risks at play. It comes as a suspension that needs to be shaken before use to equally distribute the active particles. /r/n/r/n. Dexamethasone drops commonly go by the brand names AKDexand, Decadron, and Maxidex. /r/n/r/n. Dexamethasone is usually used to treat inflammatory eye conditions causing redness, swelling, and itching such as /r/n/r/n. The dexamethasone compound will vary depending on the brand. /r/n/r/n. When using dexamethasone, keep in mind that as with any ophthalmic steroid, extended use may be problematic in some cases. Here's what to consider. /r/n/r/n. While many people have no issues when taking dexamethasone, some people may experience symptoms such as /r/n/r/n. This formulation found under the brand name Durezol contains fluorine atoms designed to enhance its potency. Therefore, it is used half as frequently as ophthalmic steroids like prednisolone drops. However, this higher potency also comes with an increased risk of raising intraocular pressure. /r/n/r/n. Since this is an emulsion, it does not need to be shaken and will remain uniform throughout. /r/n/r/n. Difluprednate is a corticosteroid used to treat eye swelling and pain after eye surgery. /r/n/r/n. Durezol contains 0.05% difluprednate. It is usually applied to the affected eyes 4 times a day beginning 24 hours after surgery and continuing for 2 weeks, and then 2 times a day for 1 week. Your healthcare provider will decrease the dose gradually depending on your condition and how you respond to treatment. /r/n/r/n. With a steroid such as difluprednate, prolonged use can be problematic. Keep the following in mind. /r/n/r/n. After taking difluprednate, you may notice side effects including /r/n/r/n. Alert your practitioner right away if you notice an increase in symptoms such as pain, redness, swelling, or changes in vision. /r/n/r/n. Prednisolone was the original ophthalmic steroid used to protect the eye from inflammation. It usually comes as a suspension with prednisolone particles that need to be vigorously shaken to distribute these equally before use. /r/n/r/n. Some of the common brand names include Econopred, Econopred Plus, and Omnipred. It also goes by Predmild and Predforte. /r/n/r/n. Branded drops tend to distribute more uniformly when shaken due to their smaller size. Prednisolone does come in a uniform solution in a phosphate form. However, this is not as powerful as the original suspension. /r/n/r/n. Prednisolone solution or suspension is prescribed to reduce the irritation, redness, burning, and swelling of eye inflammation caused by chemicals, heat, radiation, infection, allergy, or foreign bodies in the eye. Sometimes it is used after eye surgery. /r/n/r/n. Dosage will vary depending on the product. /r/n/r/n. When taking prednisolone, it's important to be carefully monitored before renewing the prescription. The eye examination may include the use of a slit lamp to get a magnified look at the eye and fluorescein staining of the corneal surface. /r/n/r/n. If prednisolone is taken for more than 10 days, vision should be thoroughly tested and intraocular pressure checked. The use of prednisolone for more than 10 days has been known to increase intraocular pressure and, in some cases, cause glaucoma. /r/n/r/n If you develop an eye infection while on prednisolone, keep in mind that it may be a fungal infection. People on prednisolone long-term tend to be prone to this type of infection. /r/n/r/n In some cases, you may experience side effects while on prednisolone. Alert your healthcare provider right away if you experience any signs of infection, eye pain, or blurred or reduced vision. /r/n/r/n Some other potentially less serious side effects may include /r/n/r/n Always alert your healthcare provider if any side effect appears to be worsening or if you simply have questions. /r/n/r/n Imagesrnrn ophthalmic steroid, known by the trade name Vexol 1%, was another steroid eye drop but has been discontinued and is no longer available. It was used for reducing postoperative swelling and redness after eye surgery and treating uveitis at the front of the eye. /r/n/r/n Steroid eye drops or injected implants can treat conditions that cause eye inflammation. Your healthcare provider will choose the specific medication and formulation that best addresses your needs. /r/n/r/n All ophthalmic steroids come with some risks for glaucoma or infection. For this reason, they are generally used for as short of a period as possible and with monitoring. /r/n/r/n .rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.